Welcome to Allen Healthcare. My name is Jane Cooperman. I'm the Corporate Compliance Officer here at Allen Healthcare, and I'm going to give you training today on HIPAA, privacy and security law, and on corporate compliance, and very brief training on HIV confidentiality. If you have any questions, if you're here in person, please feel free to ask. And everyone else, everybody, welcome. Okay, so starting with HIPAA. HIPAA is very serious. Have you worked in healthcare before, either of you?
I haven't worked in healthcare,
but you know about
HIPAA and compliance.
Okay, so most people, what they know about HIPAA is that it protects patients' privacy, and there's more to HIPAA than that, and we'll talk about it. So we're going to cover the basics of HIPAA security and privacy rule, and we'll show you what you can do to ensure that we really protect the sensitive health information, which is called Protected Health Information, or PHI. The HIPAA privacy rule makes sure that PHI in any form is private and confidential, whether it's written, spoken, or electronic. The security rule safeguards electronic PHI. And there have been recent changes to HIPAA that have increased penalties and increased federal auditing, and we'll talk about that a little bit also. Patient rights are protected by HIPAA, but patient rights existed before HIPAA. If you go back before anyone in this room was born in the 1940s, patient rights wasn't even taken for granted the way it is now. But for many, many years, we've had patient rights protection, and it's part of ethics, and so organizations had this as their ethical principles, and it's on Patients' Bill of Rights since at least the late 40s and 1950s. But in the 1990s, HIPAA came about that really formalized the protection of patient information, and it came about because of changes in social changes, really, because people were changing jobs very often, going from insurance company to insurance company, and it was important for their information to go with them. And then at the same time, the computers proliferated, and the information had to be protected. So that's why HIPAA, which stands for Health Insurance Privacy and Portability Act, that's why HIPAA has one P and two A's. People now, with patient rights that are protected under HIPAA, they have the right to have a receipt of privacy practices, which you all get when you go to the doctor. They have a right to request additional protection to their PHI. They can request alternate communication, so they can say, don't call me at my home, only call me at this phone booth on the corner. They have the right to access their information, and we can't say, no, you can't see that. And they have a right to ask us who we've disclosed the information to. They also have the right to file complaints, and they can complain to us. They can complain to the Secretary of the U.S. Department of Health and Human Services, and they can complain to the Department of Health. So we have a lot of oversight, and we have to follow regulations. It is okay to discuss PHI when you are talking to your coworkers or supervisor directly involved with patient's care. It's okay to talk about it with authorized family members. That is, the patient says it's okay to talk about it in front of my family. It's okay to discuss with the patient's doctor. And it's okay to talk about PHI in an emergency situation. You can talk to the police, and you don't have to get permission. And if you suspect abuse, you're also allowed to talk to report suspected abuse without getting permission, which stands to reason. But otherwise, we have to be careful with PHI. So there are times you can discuss it, but have to take precautions. When you discuss any PHI, you may not have patients yourselves. You may be dealing with home health aides who have patients, and you may be advising them. So anyone who's discussing PHI with the patient in front of other people, HIPAA says you have to ask the patient if they object to anyone who's there hearing their personal protected health information. And you have to do it in a way that doesn't put them on the spot. So for example, I once had a patient, as a home care nurse, I had a patient who I thought she was afraid of her husband, and I suspected he might be abusing her or certainly intimidating her. If I wanted to talk to her privately, I couldn't ask her in front of her husband, is it okay if I talk in front of him, because she would be afraid to say no. So people who are in that situation have to develop tact and the ability to be careful what they say. So you have to be careful talking to family members who are not directly involved with patient care. You would need permission. Neighbors, they don't have to know everyone's business. So when the aides go out or nurses go out to patients' homes, they can't be chatting to neighbors for the most part about patients. When you answer the phone or the door, or in a doctor's office or pharmacy. So you may know if you go to the drugstore, the pharmacy, they're trying to protect your information now, and they're not going to say your whole name or your whole date of birth in front of a whole line of people, and they're not going to say out loud what medication you're taking. That's because of HIPAA. And if they're doing it, they're actually violating HIPAA. But they can say something. They can say your name, because how else can they do business? So that's why HIPAA allows, as long as you're careful. There are times that you may not share PHI with anyone at all, other than the people directly involved with the patient's care. So friends and family, you cannot go home and share PHI. And I'm going to tell you another story. When I was a home care nurse, worked on a weekend and saw a new patient who had spina bifida, which is a congenital disease. You know what it is. It's a neural tube defect, and people who have spina bifida are disabled to a greater or lesser extent. So I took care of I went to do skilled nursing visit with this woman, and she was dressed immaculately. She was groomed immaculately. Her apartment was beautiful. She had gotten up in her wheelchair by herself. She was really very independent. I was so impressed. And I went home. I worked in Rockland County, New York, which is 12 miles from one side to the other. And I told my husband, I just saw this amazing patient with spina bifida. She lived in Valley Cottage, New York. And he told me her name, because he was an advocate for people with disabilities, and he knew everybody who had spina bifida in the county. So that actually is not a HIPAA violation, because I don't know if there was HIPAA, but also because he already knew this. I wasn't disclosing something he didn't know. But he might have known that person and not known her diagnosis. So my point is, you have to be mindful with patient information. And when you're talking about your job, and even though neither one of you is working with patients directly, things happen at work, and you have a crazy day, and it may involve a patient could come to the office and be really angry and cause a scene. All kinds of things could happen. And when you want to go home and talk about it, you have to be very mindful that you cannot disclose patient information, and don't assume that it's anonymous just because you don't mention a name. Okay. If someone calls and you don't know who they are, you're not allowed to give them information about your patient. If there's somebody, a friend or family, and the patient says, I don't want them to know, don't talk to my other son, you have to listen to that. HIPAA has a minimum necessary rule, and it has two parts. It doesn't mean that you have to do you can do the minimum necessary to do your job. That's not what minimum necessary means. It means that except for purposes of treatment, payment, or healthcare operations, any information that's released has to be the minimum necessary to accomplish the purpose of the release. And that means when an aide takes a patient to the doctor, as I was saying, the aide has to say, Doctor, this is Mrs. Jones. This is Mrs. Jones here to see Dr. Smith. She shouldn't be saying, this is Mrs. Jones. She's here to see Dr. Smith. She has a terrible stomach ache. She's going a little crazy. That would be inappropriate. So only the minimum necessary, the name, and maybe they have to give the date of birth when they arrive. Another part of minimum necessary rule is that access to PHI right here is restricted to those who need the information to do their jobs. So one of you does booking. You're booking. So you're going to need to know something. You're going to need to know patients' names and addresses and things like that. And you're working as a coordinator. You're going to need to know something. But not everybody needs to have that information. And nurses who carry devices with them, they only should have in their laptop or their iPad the information on the patients who they're assigned to see. They should not have information on every patient in the agency. That's because of the minimum necessary rule. So we don't want somebody sending out an email asking the whole all employees, has anyone seen the chart for patient so-and-so? Because people who are in recruiting don't have to know anything about patients, because everybody doesn't have to know that. So that's minimum necessary. Okay, so just because some family and phone calls are covered under HIPAA too, just because someone is a family member doesn't mean automatically that they have a right to get the information, your patient's PHI. And also, you may not know who's on the phone. For example, we had a phone call, a coordinator got a phone call from somebody who was saying, I'm going to use my name as if I'm the patient. I'm Jane Cooperman's cousin. She has Parkinson's. I think she would really benefit from having an amplifier so people could hear her when she's talking. Can you give me the name of her health plan, information about her health plan, so I can call and advocate for her to get this amplifier? So do you think that was the right thing to do? Should the coordinator give out that information? No. Because number one, health plan information is number one kind of identity theft that goes on today. And if somebody steals your health information, they stole a lot more than just the money in your wallet. They know they can have access to everything about you. So number one, it could have been somebody phishing for health plan information. It certainly wasn't Jane Cooperman's cousin, because if my cousin wants to know my health plan, why wouldn't my cousin ask me? It doesn't make sense. And another possibility, though, is that could have been a federal auditor, because I told you in the beginning they're increasing federal auditing of HIPAA. And they could have been calling different healthcare agencies to see, calling us, does Allen Healthcare have policies to protect patients' PHI, and are they violating their policies? So the coordinator did the right thing, and she asked the person for their name and for their phone number, and then she gave it to somebody in clinical. She could have given it to me. She gave it to a clinical manager who called that number, and there was nobody there. So that was okay. We would not have given out that information. So HIPAA has specific ways that you can verify someone's identity. If a call comes from a known place of business, so you get a call from a health plan and you know it's from the health plan, or a known address, or it's a known phone number, a known fax number, or a known human being. So you've been talking to this person for a long time who's been taking care of the patient, and you know who it is, you can talk to them. I once got a phone call from someone who said he was calling from the Department of Health, and he sounded iffy to me. He didn't sound like I thought somebody would sound from Department of Health. And he was calling me about a patient complaint. So I asked him, what's your name? He said his name was Alexander, but I could call him Chief. Everyone calls me Chief. I thought, this is not Department of Health. I asked for his phone number. And then I called back, and it was the Department of Health. So, and it was exactly Alexander Agulefo, who was in charge of complaints at the Department of Health in New York City. So, but I verified it, so that was the right thing, because sometimes people could get mad at the agency and fake something. People can do all kinds of things. So those are the ways that HIPAA wants you to verify if it's a person, a known person. Every healthcare provider has to have somebody who's designated to be the privacy officer. It's got to be an employee of the organization, and in this case, that's me, as I'm the compliance officer, as I told you, and I'm also the privacy officer. And I oversee all HIPAA-related activities, certainly all HIPAA privacy rule-related activities. I have to keep updated with changes in the regulations, and I have to ensure that everybody here is trained in and complies with the regulations. If you have any questions about HIPAA or how it applies to your job or a specific situation, talk to your supervisor, or you can talk to me if your supervisor is not available. If you learn of a disclosure of PHI, accidental or not, you should report it, because then we can attempt to correct any problems and prevent it from becoming worse. I can look and see if this is systemic and we have to have policy changes, or if we just have to fix one thing and somebody needs to be counseled, or so forth. So HIPAA requires that all employees be trained in HIPAA and protecting PHI according to the specifics of their job. Now, watching this video and here in the room could be people with lots of different jobs. So I'm giving you this training, and I'm giving specific different kinds of examples, but you may have questions pertinent to your job that are not covered here, and then please contact me, and I'll be giving you information about how to contact me. HIPAA requires training. It doesn't say how often the training should be. It just says training. Also, if there are changes in regulations, you're supposed to be trained. So everybody's trained at higher. Here at Allen Healthcare, we train in HIPAA annually. But the law itself only requires training. And again, I'm Jane Cooperman, and I'm the privacy officer. Now, I told you in the beginning, people can have a right to file complaints against us about our privacy practices, about compliance with regulations. Anyone can file a complaint if they believe we're violating regulations. And penalties are higher than they used to be also. So fines could be a $100 penalty for an accidental violation, and most violations are accidental. But they're still important, and we still have to follow up. And when I say violation, if I lose my laptop and it has 6,000 names in it and that's disclosed, that is 6,000 violations, not one. So if it was accidental, it could be a $100 penalty. If it's malicious, it could be a $250,000 penalty. And it could be up to 10 years in federal prison if somebody takes the information and sells it, because you've heard of stories like that. If somebody makes a HIPAA complaint, please inform your supervisor right away so that I can try to contain the problem before it gets bigger. This is how you can report it. There is a compliance hotline, so everybody can write this down, and people will be getting it in handouts as well. 718-689-1260. That is the, you should write it down. That's an anonymous hotline. If you're going to leave a message on an anonymous hotline, if you're going to leave it anonymously, please give enough information, because I can't call you back to find out more if it's not in there. Or you can call me at my phone number, 718-657-2966, extension 1927, about HIPAA violations. You can also email me, jane.cooperman@allenhealth.com. So any questions about the privacy rule yet? No? Okay. So security rule, this is more technical, and more of this involves IT, because the security rule protects medical records that are created, stored, accessed, and transmitted electronically. It protects the confidentiality of ePHI, that's electronic PHI, so that sensitive information can be used only by authorized individuals. And it protects integrity so that once the ePHI is created, nobody can tamper with it. It protects the availability of PHI so that even if we have a software failure or a power failure, the information should be available. Privacy rule and security go together and use many of the same terms. The Chief Technology Officer at Allen Healthcare is Robert Ponzo, and he works with me, and we're responsible for following the HIPAA security regulations. So the HIPAA security rule has to do with safeguards. There's administrative safeguards, security technical safeguards, and another kind. I'll tell you as we go along. The administrative safeguards are what the executive team puts together to make sure that we have systems, policies, and processes to safeguard the ePHI. So it includes security audits, it includes, as I said, policies, and watching for unusual behavior. That was administrative. Physical safeguards is how you protect the high-tech equipment and computers from hackers or intruders. So we have a lot of security in devices, and all the computers within the agency are encrypted. If you need to send something outside the agency, if it has ePHI, you have to type * secure * or * encrypt * in the subject line, and that encrypts it. Sometimes people will say, I can't open that, can you just send it regular email? You cannot. You can fax it, or they can send you their own secure email and you can respond to that securely, but you cannot send ePHI outside the agency. It includes your user ID and password. You don't share them, and I'll tell you right now, if the president of the company, if the CEO of the company, if the president of the United States, anybody tells you, this person's here for the day, can you log into your computer and let her sit at your computer so she can get these names to call? You have to say, no, I'm not allowed to do that. I don't care who asks you to do it. And if somebody asks you to do it and you do it, you're in trouble, because you're responsible for your own actions. And those people that I named, I don't think the President of the United States is going to come here. The other two are not going to ask you to do it. If your boss does, your boss will need some education, and you have to say, no, I'm not allowed to do that, and they can call me. So those are physical safeguards, how we make sure nobody else gets into the equipment. And technical safeguards includes technology that's installed to protect the ePHI. So there are ways that signatures are authenticated and that logins are monitored, and virus checking systems and all that are technical safeguards. Any questions about that? Here are there are some common privacy issues we can talk about. The privacy rule does permit certain healthcare practices called incidental disclosures, and that includes discussions between healthcare providers. So if you're in a hospital, you might, if you were working in a hospital, if I'm a nurse in a hospital, I could be sitting at a nurse's station charting, and here's a doctor, and we're talking about a patient, and there's another doctor there who's not his patient. That's permitted because people have to be able to do business, and it's incidental disclosure. But if the same group of people were in the elevator where the public goes, and we're talking about patients in the elevator, that would be a violation. If somebody, a nurse or an aide, is in a patient's home speaking on the phone about another patient, they have to use discretion. They have to speak in a low tone and not mention the other patient's name. This happens, a nurse might go to see a patient and call a doctor, and the doctor calls her back an hour and a half later, and the nurse is in another patient's home, and the doctor, so she could talk to the doctor, but she's got to not mention the patient's name then, or step outside, something like that. If you have to leave message on an answering machine, we don't have answering machines anymore. If you have to leave a message in voicemail with a family member or with somebody who answers the phone and you don't know who they are, you just take reasonable safeguards to protect the patient's privacy. Give as little information as possible. Either one of you might be doing this. You say, hello, I'm so-and-so. You could say you're from Allen Healthcare because they have to know who, otherwise they don't know who you are. Please call me back. You would say the person's name. You're not saying they're a patient. This is a message for somebody. Please call me back and give the number. That's all. If the patient requests communication in a confidential manner, you have to respect that. And for people who travel in between patients, they have to keep sensitive PHI private and confidential, not carry information about one patient into the home of another patient. Or if they have to take it into the home because it's in a device or in their one bag, in the patient's home, only take out what belongs to that patient. Another privacy issue has to do with release of patient information. The privacy rule permits us to notify family members or personal representatives or others responsible for care about a patient's location, general condition, or death. I'm not going to belabor this point. This is really about what permits hospitals for having directories and to allow you to call and say, is so-and-so in the hospital? Can you tell me the floor? And what's the condition of so-and-so? And they can tell you. That's permitted under HIPAA. PHI has to be disposed of properly. Do you think we can throw it in the trash? Mm-mm. It has to be, if it's paper, it has to be shredded. We had a breach here a year or more, it's more than a year ago now, maybe 2 years ago. We had somebody who worked in a marketing position who was going to visit some doctors, and the medical orders team asked this person to take some doctor's office, some orders to those doctors to have them signed, because they weren't signing their orders. So this person took the doctor's orders, there were 17 orders for 2 different doctors, put them in a plastic carrying tote, left it on the reception area counter. So you were in there, left it there, came into the office to do some work, and then forgot about it and went home. And the next day realized, or maybe that night even realized, that this person realized that where are the orders, and so sent an email asking if anyone had seen this stuff. So we have surveillance video in the reception area, and the surveillance video showed that somebody who were a housekeeper, not an employee of Allen Healthcare, but from the landlord, had found this plastic carrying case and opened it, took the papers out, flipped through them, threw them in the trash, and I suppose took the plastic tote. So that information I wouldn't say was disclosed to the housekeeper because it was just a flip through, but it went in the trash. It went in the trash. We don't know what happened after that. It probably got thrown into a garbage truck, but it could have fallen out on the street. If it fell out on the street, someone could have picked it up. On a doctor's order has a patient's name and address, all diagnoses, all the treatments, all the services we're providing, all the medications, birth date too. That's a lot of information. You wouldn't want that information about you to get out to the general population. So there were 17 patients affected by this. I had to contact everyone. I contacted by registered mail, and I had to tell them exactly what information might have been disclosed. So some of them, their orders didn't have as much, some had more. I had to tell them exactly, and I had to tell them how to check their credit reports and I had to document it, and I had to report it to Health and Human Services. If I hadn't been able to get in touch with 10 or more of them, I would have had to post this breach on our website. We don't want to do that because while people are shopping for home care agencies, we want them to want to come to Allen Healthcare. And if they go to the website and see Allen recently had a breach of this information, they might just go down the list to the next one and try to go there. If we had that laptop I mentioned before with 6,000 patients on it and that was disclosed, in fact, even more than 500 patients, we have to go to the news, national media, and that's when you see it on the news. We don't want that to happen either, so we take it very seriously. Paper, we don't have that much paper information anymore, but it has to be shredded when it's disposed of and has to be stored in locked cabinets. And paper should never be discarded in a patient's home, should always be brought into the office for shredding. Actually, we're having a Shred for Bread week this week, and anybody who has any ePHI or any kind of PHI at home, please bring it in for shredding to wherever you're working. Common privacy issues include how we disclose information. You need a signed authorization to disclose information unless it's used for treatment, payment, or for healthcare operations. These authorizations have an expiration date. Most people in your work are not going to have to deal with these, but there are some people who may be listening to this, watching this video, who are looking at the consent form, so they have to have an expiration date and they have to say what can be released and to whom it can be released. Revocation of a release can be any time by an individual, so someone can change his mind and it's got to be in writing. When somebody asks for PHI that's not covered by treatment, payment, or operations, we have to document that we're just providing it, and somebody has a right to ask who we're disclosing it to. Security issues. Physical security begins in the parking lot or outside the building. If you see someone who looks suspicious, notify security immediately. So I don't know where everybody's working. In this particular office, we don't have security, but we have HR department, and that's who you notify. If your building has a security guard, you notify security. There's got to be somebody in every building who's responsible for this. But if you see a suspicious person, then one thing is you have to report it. If someone comes to the agency who's not known to you, who doesn't work here, you have to, any visitor, you have to check their identification. If the person has no identification, that person has to be escorted to the destination, and most people should be escorted anyway. Laptops and devices should be secured. Nobody should leave a laptop or an iPad on a seat in a car where it's visible, even while they're driving, because then somebody just knows it's there. A car will be broken into for visible device on the seat. A car will be broken into for a pair of gloves, so don't leave things in the car. Don't share password. Remember that viruses can enter your computer, and we did have a cyber attack, so I want to make sure everybody understands. If you get an email that is asking you to click on a link and put in your user ID and password, unless you're expecting that to come to you, do not click on the link, do not enter anything, and notify IT right away. Most of the time, IT gets that email the same time you get it, and they will send out a warning. If you see a warning from IT, pay attention to it. If you make a mistake and click because it looks so legitimate, because it will look legitimate, then you realize you've done it and you entered the information, notify IT right away. Your email will be frozen and you'll get a new one. If you don't and time goes by, it puts a lot of things at risk. It makes us vulnerable to a HIPAA breach, and also vulnerable to company information being hacked, and very vulnerable. So pay attention to those warnings, very, very important. If your password doesn't work, when you try once it doesn't work, it's going to work the second time. You just have to be more careful. But if you try it and it doesn't work, notify IT, because it could mean somebody's been tampering with your information. If you're terminated, you will be locked out right away from the system. We're going to talk about compliance and fraud, waste, and abuse training. That's what this is. Allen Healthcare has a legal requirement to provide information and education to all staff about compliance and fraud, waste, and abuse. The Centers for Medicare and Medicaid Services, which is CMS, the New York office of the Medicaid Inspector General, known as OMIG, and the New York Department of Health, all three provide guidance and regulatory oversight of our compliance program, corporate compliance program. And we're required because of we bill over a certain amount of money to Medicaid. That's New York. Anyone who bills over this amount has to have a compliance program. But we want to have it anyway. So that's a lot of oversight that we have. In this training, we're going to talk about National Home Health Care Corp. Code of Business Conduct and Ethics, fraud, waste, and abuse, compliance elements, and reporting. And remember I told you that my name is Jane Cooperman, I'm the Corporate Compliance Officer? I'm going to say this at intervals, and you have to know this because at any time someone from OMIG could come into the office, and this is whatever office you're in, and come up to any one of you and say, who's your compliance officer? And you have to know. If you don't know, I haven't done my job, and I want to do my job. So Jane Cooperman is a compliance officer. So do you know who National Home Health Care Corp. is, what that is? Anybody? No. Okay. So Allen Healthcare, we're a licensed home care services agency in New York City, but we have a parent company, and that is National Home Health Care Corp. They've been around a long time, and we have some sister companies. We have Accredited in New Jersey, which is also a personal care services agency like we are. There's a company called New England Home Care, which does certified skilled services and personal care, and there is Medical Resources in Massachusetts, which also does skilled services and personal care. And all of them belong to National Home Health Care Corp. And that's who came up with this Code of Business Conduct and Ethics. So you have this in your orientation packet, but I'm sure that in orientation you didn't get this in a lot of detail, and we're going to go through it because everybody has to know about this. Last year, in the fourth quarter, I did a survey of some employees to see if they knew why do we have a Code of Business Conduct and Ethics. And I got lots of different responses, very interesting, and I don't think any of them really understood what this was. So you're gonna understand it after this. So National Home Health Care Corp. Has maintained a strong reputation over the years for honesty, integrity, and ethical conduct. To protect this reputation and promote compliance with applicable laws, rules, and regulations, it has adopted its Code of Business Conduct and Ethics. The code sets out the basic standards of ethics and conduct to which all of its directors, officers, and employees are held, including all Allen Healthcare Services employees. So no one is exempt from this. Those who violate the standards of the code or who willfully participate in or encourage, direct, or permit non-compliant behavior will be subject to disciplinary action. Okay, so the purpose of the code is to set out the standards of ethics and conduct that we all have to follow. And we want to be compliant with laws, rules, and regulations. One of the elements under the code is conflict of interest. So different things represent conflict of interest, and one is gifts and entertainment. The code has some other language about it, but all I'm going to tell you, do not accept gifts. That's the bottom line. Gifts can be used to influence, so that's why. Confidentiality. You should maintain, this isn't only about HIPAA, you should maintain the confidentiality of any confidential information entrusted to you by the company or by persons with whom you do business. If something's happening tomorrow that's a big secret, and somebody tells you and it's a big secret, you can't go home and talk about it. Okay. Waivers of the Code of Business Conduct and Ethics, there probably shouldn't be waivers, but if you think a particular activity is improper and you're not sure if it's permitted, you can disclose it to the president, who can make the determination, or you can disclose to the compliance officer. Now, the code does not include a rule for every possible situation, because I will tell you from my experience, it's a very creative person who could come up with all the different situations that come in front of us every day. You can't imagine all of them. So whatever it is, you are responsible for your own behavior to exercise the highest ethical standards applicable to the circumstances. So if you're not sure, you should be asking questions. And don't ask questions of just the person next to you, but ask questions of your supervisor or of me. So as I said, you are personally responsible for your conduct and complying with all the parts of the code and to properly reporting violations of the code. Nobody has the authority or the right to order, request, or influence you to violate this code or any applicable law, rule, or regulation. A request or order from another person will not be an excuse if you violate the code. My boss told me is not going to help. Also, any attempt by you to induce another director, officer, or employee of the company to violate this code, whether successful or not, is a violation of the code, and it may be a violation of the law. Any retaliation or threat of retaliation against any director, officer, or employee of the company for refusing to violate this code or for reporting in good faith a violation of the code is also a violation of the code and may be a violation of the law. You heard about the whistleblower's law. This is the whistleblower's protection. Nobody can retaliate against you for reporting a violation or for refusing to participate in a violation. Every credible reported violation of this code will be investigated, and that's what my job is. So besides the code of conduct, corporate compliance is about fraud, waste, and abuse. Fraud is an intentional act of deception, misrepresentation, or concealment in order to gain something of value. Fraud occurs when an individual knows or should know that something is false and makes a knowing deception that could result in some unauthorized benefit to themselves or another person. I'm going to give you an example. We had a patient who had 2 12-hour shifts of aid service, so that person needed a lot of help. This patient could not move her legs. She was bedbound. She had nurses come in every 6 months to assess her. She was bedbound. But yet, she requested that her 2 aides accompany her to her daughter's birthday party in another borough. And they all got in a cab and went to the birthday party, and one of the aides took videos, and the patient was dancing bachata. So this is fraud. Why? Because this patient was faking being bedbound, faking not being able to walk. So this had to be reported upstream to the health plan. However, you notice that the employees went to this party and took the video. Most likely, if they were taking care of her in 2 12-hour shifts, they knew about this and they failed to report it. So that's example, one kind of fraud. Waste would be an overutilization of services that's not caused by criminally negligent actions or misuse of resources. And abuse is excessive or improper use of resources that is not consistent with acceptable business or medical practice. And it refers to incidents that, even though they're not fraudulent, may directly or indirectly cause unnecessary expense to the payer, which is Medicaid or Medicare. So if you see inappropriate behavior relating to overpayments that result from fraud, waste, or abuse, you don't have to make any decision about it, whether it's fraud or waste or abuse. If it's improper, it's problematic and needs to be reported. So please report if you learn of that. Fraud, waste, and abuse are punishable by imprisonment or fines under the False Claims Act. And this is small print here. Excuse me. Some common examples of fraud, waste, and abuse include providing a substandard quality of care, falsifying legitimate claims by adding fictitious charges, submission of duplicate claims, billing for services not rendered, inconsistency between services billed and services authorized. Now, we don't do that because our billing system won't allow us to, so that's a safeguard. Misrepresenting a medical condition to obtain services, which I just described to you. Impersonating a government employee, misrepresenting benefits, obtaining kickbacks for referrals. If a health plan said, we will pay you $25 for every referral you send us, that's illegal, and it falls under this. Selling patients' information. And here's an example that applies really directly to everyday life here at Allen Healthcare. Leaving a patient earlier than scheduled. and submitting a timesheet for the full scheduled shift, or having someone clock in and out for the full scheduled shift and leaving early. If an aide does this and does not notify the coordinator, this could be both fraud and patient abandonment. So if a fraud, waste, or abuse violation is suspected, you're required to report it. And in good faith, you cannot be retaliated against. If you make a report not in good faith, like one of you doesn't like the other one and you make up something, there could be retaliation. But if it's in good faith, which means there's a violation or you believe there's a violation in the code of conduct or in a policy or in the law, you have to report it. Okay, so we talked about the standard of conduct and we talked about fraud, waste, and abuse. Now I'm going to talk to you a little bit about how we apply the OMIG elements that are required of a compliance plan. So we have a compliance plan that determines how we run this program, and it's based on OMIG requirements. So we have to have written standards of conduct and policies and procedures. As you know, we have the code of conduct. You don't get a copy of the whole compliance plan. It would just be, it's not necessary, but you get a copy of important policies that are in the plan that you have to know about during your orientation. We have to have a compliance officer, and we have one. What's my name? It was Jane Cooperman. It's good, okay. And we have a corporate compliance committee. And my number, 718-657-2966, extension 1927. You can also email corporatecompliance@allenhealth.com, or you can contact me in person without an appointment in the Forest Hills office where I am most of the time. We have to have effective education and training programs, and this is an example of why you're sitting here. We have to have effective lines of communication. So in addition to the phone numbers I just gave you, we have the compliance hotline, 718-689-1260. And we do not trace those calls. I do not try to figure out who's talking. And if somebody doesn't leave any information, I don't go and dig and see what number called. I'm sorry, if somebody doesn't leave enough information, I don't go to the IT department to say who called me. I want to call them back and find out because it's confidential. So if you want to make an anonymous report, leave a lot of information. I will tell you I get lots of phone calls on the hotline and on my regular phone, and I get emails on my personal email, on the personal Allen email, and on the compliance email, and people come to me in person all the time, and just about nobody does it anonymously. So we have really good reporting here of compliance issues. We have to have disciplinary guidelines so that there are specific consequences for failing to meet compliance obligations. And that's important because we can't say, well, you abandoned the patient, 2-week suspension, you abandoned the patient, well, this is a verbal warning, and you abandoned the patient, you're terminated. We can't do that. So there's specific guidelines that are used. And we have a zero tolerance for fraud. So if we determine somebody commits fraud, that person's terminated. We have to have auditing and monitoring, which we do. I do tracer audits every month where I look at invoices and go back to the chart and make sure we only billed for services provided and that we're in compliance with everything that has to be there for that patient for that date. We have to have a prompt response to suspected violations. We have to develop corrective action plans, and we have to report to government when required. And the compliance plan has more information about that, and that's really also meat and potatoes of my job. That's the compliance plan. For reporting potential violations, employees or patients who become aware of suspected violations of the compliance plan or code of business conduct and ethics or law or regulation are required to make a good faith report. I gave you all the numbers. Here's a slide where I would give you the numbers all over again. 718-689-1260 is the hotline. I gave you all the numbers. Everybody wrote them down. I'm not going to repeat it. Again, non-retaliation, and we've had incidents where somebody was afraid to report because of retaliation, and we had to talk it through and work it through and speak to the person who could potentially have retaliated, make sure this cannot happen. And finally, we have our corporate compliant placard, which I'm going to actually read to you because every word of this is important. and you should have a handout. Everyone at Allen Healthcare makes an important contribution to excellent patient care and to ethical, honest business practices. Our success as a company rests on our excellent reputation and requires sincere commitment to our patients and to each other. If someone in our company acts unethically or dishonestly, it affects all of us and diminishes the quality of services we are able to provide to our patients. In other words, it destroys much of the good work that we do every single day. Corporate compliance is a philosophy and practice of complying with the law and maintaining the highest degree of integrity each and every day. If you become aware of any dishonest situation at Allen and you would like to report it, well, really, you should report it by contacting the president, the director of human resources, your department director, or the corporate compliance officer. And by the way, you do not ever have to go through a chain of command with a compliance concern. If anything makes you uncomfortable, you can always come to me. And how to reach a corporate compliance officer, and once again, you get this information. By phone, you can call the hotline, 718-689-1260, anonymously. You can speak to me at 718-657-2966, extension 1927. You can email corporatecompliance.com, no, corporatecompliance@allenhealth.com, or in person. And my name is Jane Cooperman. We all try to do the right things at Allen. We bill only for those services provided to our patients. We sign in and out for those hours that we actually work. We make sure we follow the plan of care for our patients. If a member of our team is not maintaining Allen's commitment to corporate compliance, let someone know. Thank you. And meanwhile, I'm going to go on about HIV confidentiality law training. It's required by the Department of Health for anybody who might have access to patients' diagnoses. And while you might and you might not, we give this to everybody at hire. So this is about New York State Public Health Law, Article 27F. And you do not have to remember this, except it's a way to refer to it as distinct from HIPAA. After you leave this room, you don't have to remember the name of the law. But that's the law that governs the protection of confidentiality and privacy of anyone who has been tested for HIV, been exposed to HIV, has an HIV infection or HIV/AIDS related illness, or been treated for this. And this law came about when AIDS was first around, when AIDS first came out and nobody knew how it was transmitted and nobody knew it, and people were dying of it, and it was a terrible disease, and people were very afraid, and a certain segment of the population was discriminated against, could not go into restaurants, stores, anything. So this law was created to protect a whole group of people, and it applies to everybody. So this New York State law governs HIV testing, HIV confidentiality, case reporting, and partner notification, but we're only talking about HIV testing and confidentiality, and you'll see why. So it's about confidential HIV information, and I said it's any information that shows a patient has had an HIV-related test. And that doesn't mean a person tested positive for HIV. Anybody who has a test, we have to protect that information. So we have aides who go into patients' homes, could be nurses too, but usually it's an aide. This happens too, who gets stuck by a needle. We teach aides how to avoid needle sticks, but if a patient, if a patient's going to put a big bag of used needles in a laundry basket and then pile laundry on top of it, we can't control that. So aides get stuck. And when they get stuck by a needle, we send them to the emergency room because we don't know if the patient has HIV or not. Most of the time, we don't know. We could know, but we don't know. So the aide goes and is going to have an HIV test, and we'll have hepatitis tests and all kinds of tests. Once we send that, we're sending the aide to the emergency room for an HIV test. That information is confidential. I can't tell you that we sent this aide for an HIV test because it's confidential. That's what you have to know. Just the fact of going for the test is confidential. And I think the reason is people have some reason to go for an HIV test, whatever it is, and therefore they're protected. So it covers that. It covers if anybody has an HIV infection, AIDS, or an HIV-related illness. It covers anyone who's exposed to HIV by a spouse, sexual partner, or needle-sharing partner. So if I'm a patient at Allen Healthcare and you're the nurse and I say, my husband was just tested positive for HIV, you cannot tell anybody that my husband tested positive for HIV. Even though my husband's not a patient here, and I am, and I have not been tested. Because the fact that he tested positive, he's my spouse, that's protected. So just so you know that this law is very specific and very global as far as what it calls HIV information. Also, any medication specific to HIV disease or related illness. So a lot of people know other people who have HIV. And if you do, you may be aware that they take a lot of medications, and the medications, nobody else takes them. Anyone who's taking these medications taking it for HIV. It's never a mystery. That information can't be revealed. We can't take pictures of medication bottles. We can't under HIPAA, and we can't, there's no reason, so nobody should be taking pictures of medication. Okay, so, or any information about an individual's contacts, such as a spouse or sexual partner, or providing any information that may directly or indirectly disclose any HIV-related illness. So if somebody has one of those infections that you only get when you have AIDS, somebody has pneumocystis pneumonia, cytomegalovirus, or toxoplasmosis, that mostly the people who get them have HIV or AIDS, you can't get around disclosing the AIDS by disclosing these other illnesses, because they also they reveal the confidential information. Okay, so you have to, in this service, you have to know the difference between HIPAA and New York State Public Law Article 27F. HIPAA, which we talked about, is a federal law. It requires that healthcare providers maintain the privacy and security of protected health information. Article 27F is a New York State public health law, and it only covers HIV-related information. So it doesn't have to do with any other information. If you work at Allen Healthcare and you want to disclose some HIV information, though you have to comply with Article 27F, and you also have to comply with HIPAA. Any consent to release information about HIV must be in writing. And information can be released to anybody who is named in the consent, but then the information cannot be further disclosed. So that if somebody releases information to me and I'm named in the consent, I can't then disclose it to you because it was released to me. Only who's named in the consent, and the consent has to be filled in completely, all the blanks, and it's only good for 1 year according to Department of Health. There are exceptions. Just as there were exceptions to who can get information under HIPAA, there are exceptions under Article 27F. New York State and local governmental agencies that provide, supervise, or monitor health and human services may receive HIV information without assigned consent. And examples are the Department of Health, the Department of Corrections, Human Resources Administration, and the Department of Social Services. Remember, you must always maintain the confidentiality of any HIV-related information that you receive, even after you leave your job. And if you're not sure if providing information violates Article 27F, you can ask your supervisor before sharing information. Now we're going to review a couple of scenarios, then there's one more quiz, and we're done. So here's a scenario. A group of patients are sitting in a clinic waiting room, and the clinician enters and says, "Jane, please come for your HIV test results." Did the clinician disclose protected health information?
Yes.
Well, did the clinician disclose protected HIV information?
Yes.
Yes, why?
By saying out loud what she was getting tested.
That's right. Because even just getting the test is confidential. Good. Okay. The patient tells the home care nurse that her husband just tested positive for HIV. The patient's husband is not a client with the agency. Does the nurse need to keep the information confidential? Yes. Very good. You will have no information with this quiz. There's an HIV confidentiality post-test, and we have 5 questions. Okay, so you have the test in there, in your packets, in your handouts. So number 1, Article 27F is a New York State law, health law, that covers HIV-related information and HIPAA.
True.
That's not true. Why isn't it true? It's not true.
HIPAA is a federal
because it's a New York state law. It does not cover HIPAA, right? So number one is false. So you don't get the free lunch. HIV confidential information is any information that shows a person had an HIV test, HIV infection, takes medication specific to HIV disease, HIV-related illness or AIDS, or has been exposed to HIV through a spouse, sexual, or needle-sharing partner.
True.
Yes. According to New York State Department of Health, assigned HIV consent is good for 10 years. Good for 1 year. You must always keep HIV information confidential, even after you leave Allen Healthcare Services.
True.
And it is permissible to tell any family member the patient's diagnosis. That's false. Okay, so please sign your tests and date them, and sign the acknowledgement from the Department of Health that says you had the training. And that concludes this in-service. Thank you very much.